I'm Becker. I'm trying to learn medicine. Today, alopecia, and after that, another thing, Amblyopecia. And after we've done that, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that's very honest. And we're talking about diseases, probably a bit in internal anatomy. Yes. Okay. Alopecia, the medical term for baldness or loss of hair. Mostly it occurs on the head, but other parts of the body may occasionally be affected. The condition is usually inherited, but it may be caused by disease. See baldness. I think we should actually go at this point one time over. Let me see something. Balanitis. Baldness. Loss of hair, known medically as alopecia. The most common form of baldness is male pattern baldness. This is hereditary and not caused by wearing hats or washing and brushing the hair too much. Hairs begin to thin at the temples and the crown, and thinning may show itself before the teens are over. There's really, okay, that means this is completely just alopecia, loss of hair, mostly of head, not male pattern baldness or something. Okay, we need that, and we're going to do alopecia. The medical term for baldness or loss of hair. Mostly it occurs on the head, but other parts of the body may occasionally be affected. The condition is usually inherited, but it may be caused by disease. Okay. Alopecia is the medical term, we quote him pretty much, I think, is the medical term for baldness or hair loss. It occurs mostly at the head, but occasionally other parts of the body can be met with that condition as well. Other parts may be affected as well. Be affected. Usually is it inherited? Should we say one word, but we're not talking about male pattern baldness? I don't really think so, because the video is titled Alopecia, which we're going to do. Maybe you're going to stay with, or we just do it, and if you have something new, we're going to add it with the next week. I'm going to say just what's in here. See baldness. Let's just do what is here and then get to know more after we've done that. I'm going to start the camera. Okay, alopecia. Medical term for baldness, loss of hair. Usually head. Other parts can be occasionally affected. Usually inherited. I think we should mention it because I think that's strange. So we should mention it. Usually inherited, but it can be also caused through disease. Alopecia. Alopecia is the medical term for baldness or loss of hair. It is usually at the head, but it can also affect other parts of the body occasionally. It can be inherited, it is usually inherited, but it can be also caused through a disease. And that is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. I'll start the camera, and we're going to go to the second part. Amblyopia. Amblyopia. One type of reduction in the sharpness of vision. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Let's take one look if we find squint. Squint or cast in the eye is more than an unsightly blemish or embarrassment. It needs to be taken seriously because it can cause permanent loss of vision in one eye. What are you talking about? A squint or cast in the eye is more than an unsightly blemish. I don't know what a blemish is, or embarrassment. And I don't know what the word embarrassment has to do with that case. It needs to be taken seriously because it can cause permanent loss of vision in one eye. Symptoms: double vision, seeing two images in place of one when looking in certain directions. In babies or toddlers who cannot explain what they see, a squint can be recognized by the fact that in certain positions the baby's eyes appear to face in different That is meant with it. The baby's eyes appear to face in different directions. The image from one eye is then suppressed by the brain, which in the absence of medical treatment leads to the loss of vision in this. Oh, that is interesting. Okay, let's read it in one flow so that people actually can understand what I read here. Double vision. Seeing two images in one place at one when looking in certain directions. The image from one eye is then suppressed by the brain, which, in the absence of medical treatment, leads to loss of vision in this eye, lazy eye. Causes. In babies and young children, the cause is usually due to some failure in the development of proper vision with both eyes together. In older children and adults, its squint can be caused by injury, severe infection, circulation problems, or pressure on the nerves supplying the muscles with more which move the eye. Treatment of what the doctor might do. Outlook. Provided squints are tackled early enough, that is before 4 years of age and certainly before 6, the outlook is good in terms of correcting vision and avoiding permanent damage. The sight in the lazy eye cannot be restored if it is left too late, although operations can be done for cosmetic reasons to improve the appearance. The outlook for squints arising from causes other than incorrect binocular vision will depend largely on the underlying causes. I don't really know what it is, but we've read about it, page 70. Amblyopia, one type of reduction in the sharpness of vision. Okay, the eye doesn't see the sharp anymore. It is one type of it. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Okay, it's not a disease causing it, but it can be hereditary. Or the result. How can it be hereditary? What could cause amblyopia, reduction in sharpness of vision? Okay, but it can be also because a squint is not corrected. I understand it that way, that the two eyes are watching in different directions and the brain ignores then one of them and just uses one image, so it does not have two at a time the whole time. And one eye is never used and therefore it goes blind. That's what I understand from it. In some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet or certain drugs. Treating the cause sometimes improve the vision. Would be interesting if now a better diet would improve the vision. Okay, in some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet or certain drugs. Treating the cause sometimes improves the vision. Now, over time, I don't really know what I should say to that now, because I don't really understand what it is. I could just say what it is, reduction of sharpness of vision, but I don't really understand what is meant here. Whatever, we're going to do, if we do a presentation in the next video or something else, I don't know. But it was a medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the shoulder pinch training. If you're staying participate in the shoulder pinch training, then is that at your own risk, having a good and stable stance, and we're doing shoulder circles. Front, back, and down, back, and the other way down. Front. Now, long arms and strong fists. Go as far back as you can with shoulders. Back up. And down. Back. Up. Front. And down. And the other way around. Up. Back. Down. The front. Up. Back. And down. And now, the accelerating motorcycles. Legs wide apart. Go down into the knees a bit. Hinge forward with a straight leg, make the arms hang, pinch the scapulas together. Make fists, and lift the arms up and still pinch the scapulas together. Lift the arms down, and the shoulders, and another round, pinch the scapulas together. Make fists, lift the arms up and still pinch the scapulas. Arms down, shoulders down, and now the sheet jumper. Something similar. Down into the knees a bit, hinge forward, this time round the leg, let the arms hang, make fists, send the arms to the inside. Lift the arms high up and bring them together. Straight back, shoulders down and together. Now, the arms high up. And together, shoulders down, together. Release. And another time. Bend into the knees, hinge forward, the round back, let the arms sink, make fists, turn the arms to the inside, lift the arms high up and bring them together. Straighten up, bring the shoulders down, together. The arms high up, hands together, shoulders down. And now just lift the arms up and bring them down again. If this any other exercise causes pain, then don't do it. Again, the other side. And down. And now the arms to the side. And a bit in front. Then again back. And now we will lift up. Long arms, strong fists, shoulders down and together. Bring the arms to the inside. So shoulders down and together with the other. And arms to the inside. Arms to the outside, shoulders down, together. Arms to the inside, shoulders down and together. Arms to the outside, shoulders down and together. And release. Now the arms to the sides, again the fists, bring a bit in front, turn the arms in front, shoulders down and together. Change the arms back, shoulders up. And arms in front, shoulders down and together. Arms back, shoulders up and in front. And release. And now shrug. Lift the arms up, shrug the shoulders up, and let go down. Now turn the arms up, shoulders up, and all down. One more time. Arms up, shoulders up, and all down. Now press the core. Arms together, a bit down to the outside, and again down and in. And the last exercise is some diet. Have something like a sock with a long arm at the outside, and let it fall down, and try to catch it. And on the inside. And that was no, it was not. It was stretching. The elephant trunk. One arm in front, shoulders back, shoulder back, hands down. Pull the arm in and have flat fingers. Slide relax the arm. Go it back with the shoulder. Turn the palm to the sky. And the other arm. Bring it in front, shoulder back and down, pull the arm and have flat fingers, try to relax the arm, go with back with shoulder, turn the palm to the sky. This was the shoulder training. I thank you very much and until next time.